time for reflection. Veterinary practices often have environments that don't reward reflection. Owners and doctors by nature are seldom curious about human nature, and they rely too much on science to achieve success. Here's the deal, folks. 98% of what you do, the client doesn't even understand. And the 2% of what you do that they do understand, interpersonal communication, the ability to connect with one another, is the stuff that we suck at. We spend too much time working on trying to execute medicine and not enough time working on how we connect with people and getting systems right. Team members are often measured by archaic standards, or quite honestly, not measured at all. The number of hours worked, gross revenue, tasks accomplished, etc. We don't have sophisticated systems in place that reward people for continuous, steady improvement. When people are overly stressed and overly scheduled, their ability to think creatively is diminished. So, when my ability to think is diminished, I am less able to diagnose problems and learn from my experience. In other words, most veterinary employees operate in the same level of thinking that someone who's suffering from Stockholm Syndrome has, which is they begin to identify with their oppressor. The oppressor is either the owner or the manager of the business, or in some instances, the oppressor is the business itself. In other words, we start to think that we can't change anything because the business just is. And quite honestly, that's not true at all. You can stop at any time in the day and tell your clients that you are getting ready to revisit, reschedule, and reboot, and they're going to need to wait 10 or 15 minutes while you get your act together. Yet most veterinarians just slog through the day, even if things are breaking down, anticipating that nobody would understand if they stopped, collected their thoughts, and got it together. My experience has been the antithesis. Case in point, Children's Hospital and Clinic of Minnesota. They instituted what's called a blameless reporting policy. They replaced threatening terms such as error and investigation with less emotional descriptions like accidents and analysis. So the hospital culture needs to be one of everyone working together to understand process and priorities and report on them without fear of blame. In well-functioning hospitals where learning is occurring, the #1 criteria for being a learning environment is that people have a good idea of the actions of which they are responsible for. In other words, does everybody on your team look around the room? Do you know exactly what the other person is responsible for? Do you know where they start and you stop? Or are you mired by the inconsistencies of job performance and the inconsistency of expectation? So the Children's Hospital and Clinic of Minnesota found that they had increased productivity and engagement and improved patient outcomes and satisfaction when they looked at analysis and investigation, or analysis and accident reporting, as opposed to looking at errors and investigating people. Building block 2, concrete learning processes and practices. A learning practice is not achieved effortlessly, but it comes from a series of concrete steps and widely distributed activities. In our business, examples would be logistics, billing, compliance, healthcare plan delivery. So for maximum impact, knowledge must be shared in systematic and clearly defined ways. Knowledge has to flow both laterally and vertically. And unfortunately, in veterinary medicine, it tends to flow vertically. It's kind of like the American Republicans' idea of trickle-down economics. The theory is that if you let it trickle down from the top, that the people at the bottom will benefit. The truth is it dries up before it gets to the bottom, and the people at the bottom suffer. I believe this is the same in a veterinary hospital. The owners think they know 100% of what's going on, and they may, but the people at the bottom of the org chart really only know about 10% of what's really going on, and it's evidenced by the way services are executed. So you can be internally focused with an eye toward corrective actions, or externally focused, as in focus groups or employee surveys. All of this should result in information moving quickly and efficiently into the hands and heads of people who must implement. After-action review is now commonly used in many service organizations. It is a systematic review of every service, activity, mission, or critical mission. Please embolden these 4 simple questions into your autopsy, if you will, of every practice system that may break down now and in the future. What did I set out to do? What actually happened? Why did that happen? And what am I going to do next time? What did I set out to do? What happened? Why did it happen? And what am I going to do next time? An after-action review, autopsy of any particular breakdown you may have in your hospital. Building block 3, leadership that reinforces learning. This is the one that must change. I submit to you that the most reason people don't learn in veterinary hospitals is they're operating in environments of psychological warfare. The owner either oppresses people by keeping his or her thumb on the temperament and teaching people that they can't be a part of a team because it's only one way, or oppositely, the owner keeps his or her mind and hand out of the business entirely by being in a state of denial about how things are, and they let the employees run the ship. Both of those are recipes for disaster. Organizational learning is strongly influenced by the leadership, the managers, the veterinarians, and team leads. So when when leaders actively question and listen to employees, people in the practice feel encouraged to learn. Instead of asking what people are doing, we need to learn how to ask, why are you doing that? What did you intend to happen when you took this action? And when their intention is different than when their action or their outcome is different than their intention, we now have a learning moment. If we only focus on what they were supposed to do or didn't do, all we've done is teach them not to tell us what their intentions were. We must move from being punitive to being action-oriented when things go wrong. I hope this makes sense. So, what message do you send? Do the employees that you work with know that these things are important? In other words, are you into problem identification or are you into symptom reporting? Do you transfer knowledge to one another, or is it cover your ass, no training at all kind of culture? Do you conduct an autopsy, or do you look to blame people when there are problems in your hospital? The result of unconventional wisdom is this. You have emboldened employees, higher productivity, and employees and customers are given new options. So the fundamental question for you as owners and managers is, do you want employees to have the right answer? In other words, do you want them to be right? Or do you want them to think about the problem the right way? Be correct. I don't know about you, but I think we need to focus less on employees being right and focus more on creating an organization where we think about the problem correctly. I'll add here that we talk a lot about generational differences in the United States, and I am 48 years old, and I guess I'm the last of the baby boomers. And what my generation believed was that if you do things right, you will get rewarded. And what we've been taught is that's not the truth, because obviously pension plans get spent. People at the top aren't always good people. So what it has taught the younger generation is that if they think about things correctly, they will be rewarded. In other words, you will connect to your younger employees by examining process and rewarding the way they think, as opposed to monolithically expecting them to perform in X fashion. So, unconventional wisdom. Use these questions in your hospital to generate discussion around errors or problems or opportunities for improvement. What criteria did you use? Why did you come to this conclusion? Did you, or what were the alternatives that were considered before you took action here? What was your primary motivation? And I love this. What value or mission or strategic thrust of our business is supported by your thinking? My hunch is if you start to ask these questions to your employees, you will get deer in the headlight looks. And if that happens, what you know is you are not a learning practice, you are a fear-based practice where employees are more focused on avoiding these types of conversations than engaging in these types of conversations. And when I say employees, I'm talking specifically about associate veterinarians and lead employees, kennel help, nurses, client service staff, everybody. Nobody is immune from this kind of investigative thinking. So, the building blocks are meant to reinforce one another and to some degree overlap. Supportive learning environment. It's easier for managers and employees to execute when there is an environment that allows for them to reflect, talk, and think. Concrete learning processes and practices. Smooth operations, measurement, and accountability. And then finally, leadership that reinforces learning. We provide opportunities for leaders to cultivate learning. This, in essence, is the circle of learning. We create an environment where it can happen. We give tools and measurements so that people can do it, and the leaders reinforce that learning is what gets you ahead in this organization. When that occurs, people learn. So here is the address to the online tool. You can go to learning.tools.hbr.org. The complete tool is at los.hbs.edu. It's a free tool, and it's designed to answer 2 questions for your practice. To what extent is your practice, team, employee, doctor functioning as a learning organization? And I love this. What are the relationships among the factors that affect learning in your practice? The data is stratified into quartiles, so you'll find out if you're in the lower 25% or the upper 25 or the 75th percentile. It identifies areas of excellence or needs for you to improve. You can do group or individual assessments to pinpoint habit differences and commonalities and things that you can learn from one another. This tool will really, truly help you address specific problems in your practice and kind of get down to the nitty-gritty of what ails you. This is a very sophisticated tool. This is not for practices that can't figure out how to come to work on time. This is not for practices that still yell at one another instead of talk to one another. And this is not for practices that aren't engaged at an intellectual level. So I would call this an advanced operating system. And most of you that would sign up for this type of webinar series are obviously into advanced operating systems. And by the way, thank you, Elanco, for sponsoring this. I think this is a really cool opportunity, and I look forward to hearing how the rest of the webinars go. Now, you would ask each participant to score themselves and the team in each area on a scale of 1 to 100, and then compare that to actual. So here are the mean scores thus far, and this is an ongoing tally, so every month it changes. Leadership scores are 76. Concrete learning processes, 74, and supportive learning environment, 71. Obviously, this proves to us that it's easier to talk the talk and not as easy to provide it. So this test will help clear the fog between intention, cultural myth, and the reality of your business. So what should it look like? It should help employees better understand what critique and analysis really looks like. It should test your assumptions about your employees and work groups in a quantifiable way. It should create the background for having productive debates and seeking out dissenting views. It should help you to identify critical development areas for businesses. And it should be used to initiate conversation and self-reflection, but it's not the sole cure for what ails your practice. Excuse me. So the unconventional wisdom is this. Leadership alone is insufficient. The cultural and process dimensions of learning require more explicit, targeted interventions. This requires more attention in veterinary medicine to do more than modify or change the leadership structure. You actually have to change the culture of your practice. Practices, in spite of a common mission, are not monolithic. Groups or individuals vary in their learning maturity and their focus, and a one-size-fits-all approach for building team is not likely to work in today's modern veterinary practice. And by the way, a high score on this assessment does not indicate a competitive advantage, but rather an awareness that you understand and believe that these things are paid attention to in your hospital. The real growth comes if you train, 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 train. So thank you for your time today. I really appreciate it.